want to talk about is getting rid of all the active decay in your mouth and not having it come back. So for some, that means really going deeply into how they're taking care of their teeth every day. And for others, it's just maintaining an already really healthy oral ecology. And sometimes we're afraid of the dentist and we haven't gone for a long time, so we kind of have avoided taking care of our mouths altogether. But it's really key to take care of your mouth, and you'll have teeth for the rest of your life. Currently, the statistic in North America is that by 90 years old, if you've made it that long, which hopefully you all will, you've lost 90% of your teeth. And that just doesn't have to be. Especially when we look at the studies done by Dr. Weston Price, and he was able to find cultures that maybe had one cavity in 1,000. Often now when I talk to large groups of people, what I'll ask if anybody has a cavity, and we might get 4 people that haven't had a cavity in 1,000. So we've got the reverse going on. And one thing that was really neat about Dr. Price's findings is that when he would go somewhere like a remote Polynesian island, they would have a very good history until they had access to the modern world, and some kind of trade would happen with the more modern processed foods, and they would come to the port, do trading, and then that culture would have a huge escalation in cavity. And then when that somehow the trade of the processed foods would halt, then the teeth were able to regenerate themselves. So one of the #1 things to do for your oral care and for your teeth, because your teeth are alive and they're very much affected by the things we eat every day, is to absolutely cease eating any kind of processed food. So that's one way we can affect the health of our teeth inside. So there's the internal care and there's the external care, which is your gums, your enamel, and your saliva. The gums should be pink and they shouldn't be receding. And the key to the gum is that they actually hold the tooth in place. And your gums are like turtlenecks. So what you want to have is like a really nice high turtleneck around each teeth. And when they start receding, you get like, crew neck and then like a cowl neck or something. That's definitely what you don't want. Because when that part of the tooth is exposed, that part of the tooth has less enamel. And so that area is very susceptible to a gum line cavities they're called. So one of the first things you want to make sure is that your gums are pink, they're healthy, and they're all around each tooth. So that definitely takes attention, and you want to have your gum pockets at a good level. The other thing is that your teeth are really existing in this sea of alkalinity. So having your saliva be alkaline is also key. And when your saliva is alkaline, then your enamel's in good shape. And when you have strong enamel, then the microbes, because your mouth is very hot, it's like a 99 degrees in there, and a lot of microbes exist. And so your mouth can deal with good bacteria and bad bacteria, but once you get a crack in the enamel or a lesion in the enamel, or the gums are receding, then the bacteria can start going in and attacking the enamel and eroding the teeth. So that's why you want to keep everything in great shape, and that's through proper oral care. And that's through brushing properly, using the tooth serums, and salt rinses are a really great thing to do to rinse the mouth and keep the mouth alkaline. So just remember to really take care of your teeth, and if they're bleeding, if your gums are bleeding, be sure to do what you need to do to take care of that.